Hi, this is Dr. Bhaskar. I'm a consultant nephrologist in Medical Hospital, Visakhapatnam. On today occasion of National Edema Day, I am here to talk about the common but serious condition edema. Edema is a medical term for the type of swelling characterized by the fluid accumulation in the body. The reasons for edema could be either involvement of heart, liver, or kidney or severe anemia, in some cases nutritional deficiencies, and the last and least cause is some local causes affecting the venous and venous systems, supplying the end organs like legs, hands, like that. So presentation of edema depending on type of the cause, the edema can be restricted to some parts of the body, like edema can be present in the form of either facial puffiness, that is edema of the face, abdominal distension, that is called ascites, and pedal edema, that is called edema of the leg region. So depending upon the cause, presentation of the edema can be different. Like if you take cardiac causes usually presents with the edema of the feet initially, whereas in case of liver failure, edema usually presents with abdominal distension, that is distension of the abdomen. And whereas in case of renal failure, presentation is initially involves facial puffiness, that is edema of the face. And whereas in case of nutritional deficiency and the rest of the things, usually more or less involves all the parts simultaneously. When we try to evaluate the cause of edema, we should take into consideration of all these causes, cardiac causes, renal causes, liver causes, and other various nutritional deficiencies and the local causes, for which we need to run some investigations like cardiac functional tests like ECG, 2D echo, and if required, stress cardio tests. And in case of liver, we need to do some ultrasound abdomen, liver functional test, and coagulation tests. Uh, in case of renal failure, we need to do ultrasound abdomen, complete urine examination, renal function test, which includes uh, creatinine, electrolytes, and if required, and we need to do serum albumin and lipid profile. So depending on the cause of the disease, we need to we need to start the treatment accordingly. And in case of coming to the renal causes, edema in the renal causes can be due to a simple nephrotic syndrome, that is passage of protein within through the urine. And second, other causes are glomerulonephritis, and last cause is chronic kidney disease. In case of nephrotic syndrome, is a clinical condition where protein is lost through the urine due to the defect in some filtration abnormalities, which causes the decrease in serum albumin and increase in cholesterol levels, which ultimately lead to the edema of the feet, face, and abdomen. In severe cases, a patient may need to undergo renal biopsy, that is a histopathological examination of the kidney structure, which helps in guiding the treatment. In some cases, patient may need immunosuppressive drugs like steroids and some other immunosuppressive medication. In second causes, AGN, which is called acute glomerulonephritis, in which most of the cases are mainly due to the some infection followed by leakage of protein within the through the kidneys. In these cases also, so we need to identify the cause, and if required, we need to do biopsy, for which we need to biopsy depending upon the severity of the disease. We need to plan further regarding the treatment of AGN. And coming to the final thing, that is chronic kidney disease. In this, there is a permanent damage of the kidney, which leads to the loss of protein through the urine, which ultimately leads to the edema of the feet, to face, and abdominal distension also. For all these cases, we need to start with diuretics, which is called decongestive therapy, so which helps in decreasing the edema symptomatically. But ultimately, we need to address the exact cause so that we can completely stop the recurrence of the symptoms. In case of CKD, some patients may respond with medication like diuretics. Some patients may not respond with these diuretics, for which we need to go for hemodialysis, in which we can reduce the edema by mechanically removing the extra fluid within the body. And finally, if these symptoms persist in spite of medication, all those things, we need to continue hemodialysis weekly twice till the symptoms relieve. If required, we need to undergo for renal transplant if the cause is mainly due to the CKD. So main things are we need to identify the exact cause of the disease. I mean, exact cause of the disease which causing the edema, and we need to give the symptomatic treatment if and also start the treatment which is required to sort the cause. That's it. Thank you. Thank you very much.